So Kate, I was going to ask about testosterone, which is typically seen as the male hormone, the male sexual hormone. And we're all aware that sort of testosterone affects sort of male characteristics.
Yeah.
But it is actually very important for women too.
It is. And as you say, we assume that we kind of associate it with men, but actually women do have low levels of testosterone in their bloodstream naturally. And it's an important hormone. But what we don't want to see is testosterone rising too high. So women with polycystic ovarian syndrome or PCOS can have high levels of testosterone. Not all, but some can. And if they do, then they will exhibit the kind of male pattern symptoms. So those could be thinning of hair on the scalp, excess bodily hair where women wouldn't really want it and have to deal with it, acne, oily skin, those type of things. So it can be a very troublesome hormone for women.
Yeah. And there's also a role, I think, in sometimes with the treatment of menopause. For some women, testosterone might be an option.
Absolutely. Yeah. So in women who have reached menopausal age, for some women, they will find that the levels of testosterone are very low, because it's important that we have a bit. It gives women that kind of get up and go, a bit of vitality, strength as well. And some women can feel that perhaps they are lacking in testosterone, and that might be exhibited by lack of libido, for example. So in some circumstances, and again, it's quite strict how it is prescribed, but in some circumstances, if a woman is struggling with libido, then she can be prescribed testosterone. And the issue is it's testosterone gel, and it's only available in male amounts. So it's quite difficult to titrate that for a woman and to have a small amount. But it certainly is possible for women to have testosterone replacement should they need it.
And there is, I think, a licensing issue in this country.
That's right.
So it's be given to women sort of off license.
Yes, it's off license and generally prescribed privately.
Yeah. And I know that there's a sort of process to go through in terms of monitoring, baseline monitoring and things like that, isn't there?
Yeah, so we would always make sure we do some blood tests before we start a woman on testosterone, and then repeat those blood tests after she's been on it for a number of weeks, just to make sure that you're not getting too high levels of testosterone.
Yeah, great.
So Adam, we know that men have good levels of circulating testosterone, or they should have good levels of circulating testosterone. But sometimes that can be a bit challenged and they might not have great levels of testosterone. What can men do about it if they're worried about their testosterone levels?
Well, so testosterone levels can decline either naturally with age, although that's not inevitable, or they might be low in relation to other medical problems. So, for example, men with diabetes often have low testosterone. Men who are overweight may have low testosterone, or there are a huge other number of factors as to why testosterone levels might drop. The difficulty with picking up low testosterone is actually the symptoms are quite what we call non-specific. So you might not automatically think it's a hormone problem. In men, it often sort of manifests as sort of low mood or lack of energy, loss of libido, erectile dysfunction, and things like loss of muscle bulk, loss of body hair.
Hair? Hair on the head.
Yeah.
Are bald men, do they have more testosterone or lower testosterone? I've always been intrigued by that.
Yes, well, that's the question everybody wants to know. So I don't want to disappoint bald men, but I don't think they have more testosterone.
They might be very disappointed.
Yeah, there is something about the way their body and the hair follicles respond to testosterone that results in the baldness.
Okay.
I mean, I've heard of the expression "solar panel for a sex machine." I'm not sure quite. I'm not quite sure that's true medically speaking, but. Yes, but joking aside, low testosterone levels can be a big problem for men.
Yeah.
But actually, something that is fairly easy to detect. It is a blood test, and can be addressed not just with medication, but with lifestyle changes as well.
Okay. So, what would you suggest with regards to lifestyle?
Well, the key things really are sort of maintaining a healthy weight, avoiding too much alcohol. Cannabis can affect testosterone levels, so avoiding that. Certain medications will influence your testosterone levels, so things like opiate medication and antipsychotic medications. So being conscious that they might be having an effect is important.
So if a man has low testosterone, what can they do to improve their levels?
Yeah, well, there's one thing is really to try and work out why the testosterone is low. So normally what we would suggest is if you found to have low testosterone on a blood test, it should be repeated, and the blood test ideally should be done between 7 and 11 in the morning when levels are highest, and with having fasted overnight. At that point, a man would normally also have a number of other hormones checked, primarily a hormone called LH and another one called FSH, which helps identify, is the problem with testosterone production in the testicles, or is it a problem with the production of hormones in the brain?
Yeah.
Or is it the influence of other health problems, like, for example, diabetes or being overweight? So there's a process in working out why testosterone is low. If it's found to be low, there are quite a few things that men can do for themselves to help improve their testosterone levels. So drinking alcohol moderately is one thing, not smoking, maintaining a healthy weight, and making sure that any diabetes is well controlled. Other things that are important for testosterone levels are exercise, and particularly sort of high intensity interval training is good for promoting testosterone, and other kind of weight training as well is good for increasing testosterone levels. There is, for some men, there is an option for testosterone replacement therapy, which is a sort of a treatment decision based on a number of factors that should really be discussed with the doctor.
Yeah,